Hello, so today we're going to be learning how to take vital signs. So I will first be putting the pulse and oxygen recorder onto the patient's finger. This tells you what percentage of oxygen is in the blood as well as their pulse. While that is processing, I will be counting the patient's respiratory rate. I will do that for about 15 seconds, then multiply it by 4 to see what her respiratory rate in a full minute is. The average is around 6 to 12. On this patient, she had about 8. So then I will be applying the sphygmomanometer. I cannot say that to save my life, but this records blood pressure. There is a line that tells you where you need to align the brachial artery with, so make sure that that is in the correct place. Then take your stethoscope and apply it onto the brachial artery. Part of the stethoscope will be underneath the blood pressure cuff. Then pump until about 180, and then slowly start to release until you hear a heartbeat, and that will be your top number. And once the heartbeat stops, that will be your bottom number. So on this patient this day, she was about 120 over, I believe, 80. And just take the cuff off, and you are all set with those vital signs. So next, we are actually going to learn how to do manual pulse. So you will be taking 2 fingers and placing them onto the patient's radial artery, then count for about 30 seconds and multiply it by 2 or 15 to multiply by 4, depending on how long you have with the patient, and that is how you take manual pulse.